Brilliant. Thank you very much for coming to this presentation at the moment for looking at an overview of hepatitis and its management. Brilliant. So here we can see the overview of what we shall be looking at. The introduction of what makes hepatitis B viral infection important, causes of or risks of transmission, symptoms and signs of hepatitis B, diagnosis and treatment. How do we go about all of this? This is like rocket science to many people, especially those who are infected and they don't have an understanding of what really this is all about. I must tell you that it can be really, really easy for us to be talking about this at the moment, but I do not think that the people who are actually affected understand and are confused by the systems that they live in. And so we'll take some time and go through this. Now, hepatitis B is a liver infection caused by a virus. Our virus is, don't be confused with a computer virus, but it is, this virus enters the system and then leads to an infection, inflammation. Inflammation is when the tissue is damaged and then the body responds to it, causing all kinds of damages that would affect the cell structure and the ability of that organ, in this case the liver, to function. When this continues unabated for a long time, something called cirrhosis is formed. Cirrhosis is just a stiffness of the liver, meaning that it becomes stiffer and not as soft as it should be. And then cancer cells can develop in that background. That is an unfortunate situation we don't want to happen, but many people die from liver disease due to hepatitis B because they have developed cirrhosis and cancer. How is hepatitis B spread? Second part, blood, semen, or other body fluids. When these fluids enter from a person infected with the virus into the body of someone who is not infected. In other words, the fact that you're exposed to blood does not automatically mean you have the infection. It is just that if that blood you're exposed to is from somebody who has hepatitis B infection, then you become a victim. Sexual contacts with those who are infected, sharing needles or syringes and drug injection equipment. And the most important one that circulates in most developing countries is when a mother who is infected gives this infection to the baby at birth. This is very common in Asia and Africa. And most people who live in developing countries will actually not remember when they got infected. Now, for most of those who are infected, infection lasts less than 6 months. This is really the acute one. Whereas for others, it goes beyond 6 months, and which can lead to serious life-threatening health issues that I mentioned before, which is cirrhosis or liver cancer. Now, if someone gets hepatitis B viral infection in adulthood, there is a 5% chance of progression to the complications. Now, that is only a good news for the developed countries. Of course, not good news for the person affected, but on the big picture, those living in developed countries do not often have this progression as much as those living in the developing countries. If you acquire this infection as a child, which is the case in developing countries, then there is about 95% chance of chronic progression. The best way to prevent this hepatitis B is vaccination. This is one condition that has good effect. When vaccinated, there is about almost 100% chance of protection if the vaccine uptake is good and the immunity develops. Wow, this germ is tiny. It's very tiny, small, smaller than a bacterium. It's only with the aid of an electron microscope. So it's not something you can see, oh, yeah, it is coming, I will get rid of it. The best way is healthiest lifestyle. So who are the people at risk? A child born to an infected mother, when there is contact with blood from open source, this is a risk to nurses and doctors who take care of wounds. when there's exposure to needle sticks or sharp instruments. Number 4, when there's sharing of certain items with an infected person that can break the skin or mucous membranes, for example, sharing toothbrushes. Number 5, when there's sexual encounter with somebody who is infected. Now, this is not a very common mode of infection in developing countries because most infections by hepatitis B occur in childhood in that part of the world. This is really to be stressed because some people have had misunderstandings due to this, but it does occur anyway. Infection drug use that involves sharing needles or syringes, and then tattoos or scarification marks. Now, how are the symptoms? Not everyone with acute hepatitis B will have symptoms. If they are present, they will be including some of what I will be showing you, but not at this point. That most patients with chronic infection are diagnosed incidentally or are discovered as part of investigations for an abnormal blood test. The symptoms of hepatitis B virus infection, when present, will include the following: an abdominal pain. Most will have no symptoms at all, but abdominal pain can be something that is experienced in an acute phase. Dark urine and passage of it, or sometimes yellow urine. Jaundice, which is yellow discoloration of the eyes, and or skin if they are people who are of light skin nature. Fever, which is temperature, and nausea or vomiting. Weakness or fatigue, tiredness, extreme tiredness indeed, loss of appetite or joint pains, common symptoms in acute infection. Now, let's go and look onto the signs of chronic liver disease or infection. Now, if the infection lasts for many years, 15 to 20 years, and then it can lead to various complications, and some of which are shown here. Ascites is when there is fluid collecting in the abdominal cavity. Now, the second picture here is a male with enlarged breast tissue, which is something there. We see cubic medusae here. There is spider nevi and jaundice. Known aspects. Now, how do we diagnose hepatitis B infection? Very simple. A single blood test can do that for you. The hepatitis B surface antigen is a rapid test. Within minutes, you know the outcome of it. The test is interpreted as reactive or non-reactive. When it's negative, it is non-reactive. That means if you are at risk of an infection, like a healthcare worker or a partner of somebody who has infection, you are living in a place that is highly endemic for infection, you need to have a vaccine to protect yourself. If you're positive, and that defines infection. Now, whether that is chronic or active infection is another ballgame. But what you need is that once you have an infection, then you qualify for evaluation for treatment eligibility. Not everyone who is infected needs to be treated in the real sense of the word, because treatment is only going to be beneficial to a few groups of people, which I will mention later. Here is a battery of tests that you can actually get done to define your eligibility for treatment. It's a combo test that is known by many people, and that you can get as well in the slide that will follow if you request it via my website. We then go ahead to conduct something called serological markers. Now, antigens are proteins that are produced from viral particles, whereas antibodies are those proteins that the body produces as a response to the antigens. So these in permutations are combined together, which then defines what needs to be done for the patient. Again, this is quite a busy slide describing the combinations and permutations of these antibodies and antigens that define what happens in terms of the decision to treatment or vaccination. Again, it's taking me back here, but we've gone past this part. I will take you back to this point here, and then there you have treatment there. this point we've mentioned, sorry, I go back to that point again. All patients qualify for treatment, all patients who have cirrhosis, whether they have a higher hepatitis B DNA, that is viral load, abnormal liver function, or is normal, it doesn't matter. Once there is established different diagnosis of hepatitis B, then you qualify for treatment. So you start treatment for them. Of course, whether that has any impact, there is evidence internationally that it can help some people. Second group is when there is co-infection between hepatitis B and hepatitis and HIV. You qualify for treatment regardless, because there are drugs that work for both hepatitis B and HIV. And when you're going to be on HIV treatment, you include the medication that works against hepatitis B. The second group is that if they don't have cirrhosis, their viral load has to be high, more than 20,000. That is when the drug can work efficiently. So this is very important point to note. The third point, sorry, I jumped that point, is when, okay, sorry, this is the third point rather. Now I go on to what would you do to make sure that these patients are actually well treated so that they don't actually have resistance or they don't fail treatment, which actually means that they will have the risk of going on to developing cirrhosis or liver cancer, regardless of treatment. So you want to educate the patient very well. Talk to them about substance misuse, alcohol and tobacco, which are not good friends. Talk to them about the fact that when you start medications, you don't stop so that it doesn't develop resistance. Remember, lamivudine used to be the treatment, but this has not been useful at the moment. It's failed because of resistance issues due to indiscriminate use. Sometimes people are giving it for 6 weeks, sometimes 6 months, and that is useless. It has actually made that drug useless. So when you start treatment, no stop. This is because hepatitis B is treatable but not curable. Treatment, when continued, it will keep the disease at bay, and most people die from unrelated illnesses. Discussed about the willingness to commit to lifelong treatment. Lucky enough, the medication is not so expensive, although this can be a big hurdle for some people who are really living below the poverty line. And so it's important to start treatment and be monitored because of side effects of these medications. Educate on benefits and side effects, which is the most common side effects is kidney dysfunction. In other words, kidney failure, which is not common but does occur. If that is found during the course of treatment, you are advised to stop and switch to another medication, which is less sensitive, however, able to work and sustain the mechanism that has been instituted with tenofovir. Good lifestyle, physical activity, no gainsay about that. When the body is fat and there's excess fat accumulation in the liver, the drugs will have no use or limited use. So pay attention to lifestyle, prevent non-alcoholic fatty liver disease in the background, and you will be on a good sail to succeed. Here is a summary of what treatment options there are. Of course, these are first-line treatments, and if they fail, the specialist has a mechanism of going about things. Tenofovir is the medication that is used in adults, and entecavir for children. But again, there are second-line medications. These are not to be taken. I'm not prescribing this for anyone to take off the internet. It's important that there is definite evaluation by your specialist before you go on to taking these medications. Congratulations for staying with me. Do subscribe and consider joining us for future events. Join us on our Facebook page or go to our website and subscribe, and you will read a lot of healthy lifestyle blogs and you would not regret. Thank you very much. God bless you.